Sometimes people think I do, but I don't smoke pot. And it just is not for me. I think that it's bad for my brain. I'm not into it, but people think I do smoke pot because I'm in favor of legalizing marijuana. And we're in a really weird place with marijuana right now. Like it's illegal in some places, but it's illegal everywhere, but in some places it's kind of okay. But if the state thinks it's not okay, then let's throw those people in jail. I feel like it leads to excessive incarceration, especially among minorities. And in places where it's been legalized, everything's doing okay. Yeah. How do we move forward out of this legal gray area weirdness?
Does the way you feel keep you from doing simple things you enjoy? Discomfort can stop you and steal all the fun out of life. If you are dealing with daily discomfort, you know how it can slow you down. But now, there's an amazing breakthrough that can help you feel better. Introducing Can Chew Gum. Can Chew is a unique combination of great-tasting 100% all-natural ingredients developed by a team of doctors. It is the first hemp CBD gum. CBD stands for cannabidiol. Can Chew Gum is non-habit forming, doctor recommended, no prescription needed, and now it's legal in all 50 states. Can Chew Gum has been featured in major newspapers and national magazines. The secret is, each piece of Can Chew Gum contains 50 milligrams of hemp oil with 10 milligrams of naturally occurring CBD.
Can Chew helps me keep going so I can get through the day.
When I chew Can Chew Gum, I just feel great.
Can Chew Gum is loaded with powerful nutrition. The natural hemp oil is rich in heart-healthy omega-3s. It's a great-tasting gum that's actually good for you. The minty fresh flavor keeps your breath fresh, while the CBD helps you feel great. Can Chew Gum has no artificial sweeteners or preservatives, and it's non-GMO, gluten-free, vegan, and kosher. Call or go online now and get a 16-piece pack of Can Chew Gum for only 2 payments of $19.99. If you don't love it, send it back for a full refund. Order now, and you can add a second pack. You just pay separate processing and handling. That's an $80 value, all for only 2 payments of $19.99. Tap the amazing power of CBD and let Can Chew Gum help you feel great so you can really enjoy life. Order Can Chew Gum now.
Well, what you're seeing now is Colorado, Washington, through state referendum, they're experimenting with legal marijuana. The position of my administration has been that we still have federal laws that classify marijuana as an illegal substance, but we're not going to spend a lot of resources trying to turn back decisions that have been made at the state level on this issue. My suspicion is that you're going to see other states start looking at this. What I am doing at the federal level is asking my Department of Justice just to examine generally how we are treating nonviolent drug offenders. Because I think you're right. What we have done is, instead of focusing on treatment, the same way we focused, say, with tobacco or drunk driving or other problems where we treat it as a public health problem, we've treated this exclusively as a criminal problem. And I think that it's been counterproductive, and it's been devastating in a lot of minority communities. It presents the possibility, at least, of unequal application of the law, and that has to be changed. Now, the good news is that we're starting to get some interest among Republicans as well as Democrats in reforming the criminal justice system. We've been able to initiate some changes administratively, and last year you had the first time in 40 years where the crime rate and the incarceration rate went down at the same time. I hope we can continue with those trends because there's just a smarter way of dealing with these issues.
Canaway is the only relationship marketing company offering CBD-rich hemp oil products in all 50 states.
The Cannabis Beauty Defined Anti-Aging Skincare line has been described as one of the finest anti-aging lines available today. The anti-aging industry exceeds $9 billion in annual sales and is being fueled by the baby boomer generation. In today's world, 60 is the new 40, 50 is the new 30, and Canaway's Defined line is helping people look and feel fabulous. The Defined line is made up of a full regimen of anti-aging products highlighting our internal-external approach to staying young and vibrant. Defined features a 13th century Korean bee-bong formula that for hundreds of years was only available to the Korean royal family. For the first time through an exclusive relationship with Canaway, this carefully guarded bee-bong formula is available for everyone to experience and enjoy amazing results.
Our Canakick Energy Chews can give active adults a convenient and healthy alternative to traditional energy products. Canakick's all-natural, non-GMO formula includes 5 milligrams of CBD-rich hemp oil that provides you up to 3 hours of focused mental clarity and energy. Canaway has introduced Hemp Vape, a healthy alternative that's hip and stylish, containing no nicotine or carcinogens. Hemp Vape is the first ever hemp-based CBD vaporizer on the market. The vapor industry is sweeping across America and is projected to exceed billions in sales by 2015. Using hemp vape while on the go makes this a natural fit, as you can get your CBD-rich hemp oil in a portable format that tastes great in a variety of flavors, including strawberry, papaya, and honeydew.
There are over 25,000 products that can be made from hemp. So what's next for Canaway? The sky's the limit.
My name is Dean Pitcanis. I'm the Chairman and CEO of Cana Life Sciences. We are currently the holders of an exclusive license with National Institutes of Health, the 507 patent known as cannabinoids as antioxidants and neuroprotectants. The opportunity to work with a network marketing company, Lifestyle Network, was very appealing for us to involve ourselves scientifically and also to develop products for sale and through the network. So we had recently signed a 5-year deal with Canaway that will involve ourselves as product specialists for standardization, quality control, quality assurance. And that's how we began the process of working with Canaway. The first thing that comes to mind is like an acronym called DIAL, like Dial into Success. And I'm really excited about being involved with Canaway and being part of their advisory board because it embodies dedication. It involves a really strong attitude, a loyalty factor, and integrity is the I in the dial, which is really important. And I think that our aim is to make products that embody that. I'm really excited about being part of the advisory board. I think the competencies of the science behind what we're doing and the effort that's being put forth really makes some very nice partnership between the companies. So it's a real opportunity for us to be involved in a very big way.
There's been a total of 61 concussions so far this NFL season, and while public frustration grows, players need treatment.
You're always smashing heads into one another, and so you're getting dizzy on a constant basis. You're seeing stars every day. Sometimes you're depressed, sometimes you're moody, sometimes you have headaches, and that's a reality of the game.
NFL doctors use opiates to dull the pain. But many players say those drugs are doing more harm than good.
It's a serious epidemic, just as bad as crack or heroin, and I think medical marijuana could be an alternative.
Former NFL player Tank Johnson says a majority of players are already smoking weed.
70–80%. I mean, I hate to say that as if it's a bad thing.
So it's clear NFL players will get concussions, and a good number will self-medicate. Dr. Lester Grinspoon says they're onto something. A certain part of marijuana can be an effective treatment for head injuries.
We are now pretty confident that cannabis, marijuana, has as a medicine some qualities about it which make it clear that it is neuroprotective.
And as the effects of CTE only become scarier, treatments that challenge the status quo are starting to be heard.
We've talked a lot about CBD, a strain of marijuana used to treat children with seizures. It's now being used in a product called Canalife, an experimental drug that has been hailed as treatment for head injuries. We're now joined by Dean Petkanis and Marvin Washington. Mr. Petkanis is the CEO of Canalife, and Marvin Washington is a former NFL player who's now a spokesperson for the company. I want to welcome both of you to the show. And Marvin, I want to start with you. As I said, you're a former NFL player, and you've said that many players are on pot, but you've said that 100% of players are using pharmaceuticals. Walk me through what the doctors in the NFL prescribed to you when you were playing ball.
Well, not only just prescribed to me, but they prescribe them to everybody just to get through the NFL season. You're talking about anti-inflammatories from your naproxen, your Indocin, to your opiates that, block the pain, which is a Toradol shot that you get before the game. And then after the game, all the painkillers. And sometimes you're taking the painkillers during the week, and you're taking the anti-inflammatory during the week. So you're on a seven-day regimen of pharmaceuticals. And we wasn't educated enough to know about some of the damage that it does to your liver and kidneys, and I still don't think they're telling players that, but some players are opting out and looking for alternative medicine.
And of course, the dependency that comes with that kind of a cocktail. Now, Dean, what is Canalife in essence? Can it fill this void?
Well, we're working towards a research and development pact right now where we had first started looking at cognitive impairment design through hepatic encephalopathy, which is a disease that we targeted to form a brain liver disease. We think that neuroprotection could be afforded in our R&D that we started in that pathology and cross over into CTE, which is also neurodegenerative. So we think that there's some good parallels there to start with, and we're zeroing in on a drug that we can bring to the marketplace. Hopefully in mid-2015 we could file an investigational new drug application with the FDA.
So in layman's terms, let me just rephrase this so you can help me understand. This is a drug that contains weed, or THC, if you will, that will help treat the disease that comes from concussions?
Well, let me take you a step back. There's a bunch of chemicals inside the plant, THC being one of them, and we're not really looking at that model. We're looking at the cannabidiol model, which is CBD. And CBD is a constituent of marijuana and hemp in the natural form, and it can be synthesized and it can be used in either a prophylactic type of drug where you have some low-grade milligram dosage that could be taken over time to protect athletes if it is truly the neuroprotectant we think it is. And in severely acute injuries or concussive injuries, maybe a pharmaceutical drug that can be derived that's much more potent. So we're working on both sides of the panel, both on the natural side and on the synthetic side, but we're looking specifically at cannabidiol and cannabidiol-like molecules.
Now, Dean, you mentioned the FDA. So how would you get this FDA approved if marijuana is still federally a Schedule I drug?
Well, you've had in the past instances like Marinol, which is a THC synthetic that was developed in 1986 for wasting or patients that suffer from AIDS. They needed appetite improvement, and so Marinol was used in that capacity. It was called dronabinol, and it was rescheduled by the DEA in order to allow it to get through the FDA for approval process for use of medical use. So you can get a rescheduling of a particular drug in the event that the FDA sees through the clinical side of the review process and it's deemed safe for human consumption. Now, something to really focus in on is cannabidiol is not psychotropic or psychotoxic, whereas THC binds to the CB1 receptor, causes a psychotropic high. Cannabidiol does not do that, and therefore is a constituent of marijuana and hemp that doesn't form any psychotoxicity.
But I want to get Marvin in here because, Marvin, you've dealt with the NFL's harsh stance on weed. You've been very critical of that. Do you think that Canalife stands a chance at changing that?
Of course. I wouldn't be doing it if I didn't think we had a chance, because one of the things that Dean said, like CBD has no psychoactive effects, and there needs to be made a distinction between the THC recreational side and the CBD, which is the medical side, and that's what we're focusing on. And if it comes to fruition, this is going to make the NFL game safer. It's going to make the game safer for everybody that plays a contact sport, not only in the NFL, but in hockey, UFC boxing, lacrosse, soccer, whatever it is, a contact sport is going to make it safer. And so you can have a 12-year-old girl in Iowa take it and a 27-year-old professional football player take it, and it's going to do the same thing. It's going to act as a neuroprotectant for the brain, and it has no psychoactive effects.
Now, Marvin, you have close ties still to the NFL. Have you talked to them about Canna-Life?
No, I haven't, not as of yet. This thing is in its infancy, and so I want to get the science built up, get some proof of concept, and some peer-reviewed papers out, and then we're going to definitely approach the NFL about this, because the NFL right now, they're saying that they're following the science, but I believe, and the medical community believes, the NFL needs to lead the science, because when they get behind something, they can move the needle.
Thank you so much, Marvin and Dean. At least we're talking about alternatives to these pharmaceuticals. We'll be sure to follow Canna-Life's progress as it develops.